Hi, Dr. Jordan Tishler from InhaleMD. So I got asked the question today, so what does it mean when you say start low and go slow? And frankly, that's a very good question. When I talk about this, I tend to talk in terms of puffs, or what somebody might call hits. And this applies also when we're talking about using edibles. But the idea here is to kind of assess where you fall in the cannabis experience department. Now, I don't mean sort of what your background or feelings about cannabis are, but rather what is your body used to? And many of my patients come to me and they've not used cannabis ever, or that's been months to years since they have used it in any fashion. And so we're really talking at that point about somebody whose body is not used to this substance or naive to this substance. So going slow and starting low, we might talk about taking one puff on a vaporizer. One puff, roughly speaking, is about 3 to 5 milligrams of the THC component. So it's a fairly low dose. Now, for most patients, one puff's probably really not going to do it. But if you really haven't seen this stuff before, it's not a bad starting point. And then in terms of the going slow aspect, we really want to advance that sort of over a number of days. So I wouldn't say like take one puff today and then tomorrow you're going to go right on to 2. So you might take a puff tonight and then you might take the same one puff tomorrow. And after a few days, maybe 4 or 5, then we're going to advance to 2 puffs. And for most of my patients for whom cannabis is new, 2 puffs is really where they end up. Remember, that's sort of 6 to 10 milligrams. And for a lot of patients, that's really the sticking point. My general recommendation is that we think in terms of 2 to 4 puffs as the starting range, and we kind of have to see starting at 2 and creeping up from there where we find the most benefit with the least side effects. So that's what I mean by go slow, or start low and go slow. Thanks very much. Jordan Tishler from InhaleMD.